Welcome to Section 1 of Endocrine Pharmacology. In this section, we'll be discussing insulin preparations for diabetic patients. This image depicts the various types of insulin that someone can be prescribed. It's broken down into 4 main categories, which will help you memorize in the story afterwards. The rapid-acting preparations are at the top. These include Lispro, Aspart, and Glulisine. These reach their peak activity about 1 hour after administration. Next are the short-acting preparations. We just call this regular insulin. And this regular insulin reaches its peak activity in about 2 to 3 hours following administration. Next is the intermediate acting preparation, referred to as NPH. In case you want to know what NPH stands for, it's written out here. But if you know that NPH is an intermediate acting preparation and reaches its peak in about 4 to 10 hours, then that's all you need to know. Lastly are the long-acting preparations. These include Detamir and Glargine. These are so long-acting that we don't really see a peak in their activity. Now let's dive into the story. This story takes place at an acting school where a coach who specializes in helping actors make insults on the screen look natural is working with a very short actor to help him perfect his insults. Let's zoom in. Notice the sign with the information about this class written on it. This class is called Regular Insults, and it lasts between 2 and 3 hours. Remember that insults are our recurring symbol for insulin. So this short actor insulting his acting coach for 2 to 3 hours at a time will be our symbol for regular insulin, which is short acting with a 2 to 3 hour peak. In case you didn't already notice, this is a super intense acting school that employs some pretty extreme methods to help their students perfect their craft. One of those methods is to squirt acid on the heads of their students while they're practicing a given technique to see if they can maintain their composure under stress. Notice that the short actor has a great set of dreadlocks with dyed beads in them. The acid here should help you think of ketoacidosis, and dyed beads like those in his hair are the recurring symbol for diabetes. So this interaction with the acid being squirted on the head of the insulter with dyed beads in his hair should help you remember that regular insulin is used for diabetic ketoacidosis, or DKA. Another particularly short actor is waiting for her insult class to start, and in the meantime, she's gluing a bunch of bananas into place on a banana hat that she made for an upcoming audition. A bunch of bananas are our recurring symbol for hyperkalemia, so this should help you remember that regular insulin can be used for hyperkalemia. Also, glue is our recurring symbol for glucose, so this should help you remember that glucose can be added to prevent hypoglycemia when using insulin to treat hyperkalemia. And that makes sense. If a patient has hyperkalemia and you want to give them insulin, you're going to expect that the insulin will decrease their blood glucose levels. So it makes sense that you'd want to add glucose at the same time. Another short actor who just had a rough time at his insult class can be seen punching a big bag of sugar and angrily shouting insults at it to help him de-stress a little bit. This big bag of sugar represents hyperglycemia. So this stressed out guy shouting insults while he punches the bag of sugar should help you remember that regular insulin is used for stress hyperglycemia. Now there's another sign on the ground pointing to a class called rapid acting, which is a 1 hour class. This should help you remember that rapid acting preparations of insulin have a 1 hour peak. Near the rapid acting sign, there's a display advertising some of the services offered at this acting school. One of the services is called Lisp Pro, and its purpose is to help aspiring actors to overcome speech impediments. Lisp Pro sounds like Lispro, so this will be our symbol for Lispro, which is one of the rapid-acting insulin preparations. There's another service advertised called Aspart, which is designed to prepare actors who plan on having parts where they might need to show a little ass on screen. Aspart sounds like Aspart, so this should help you remember that Aspart is also a rapid-acting insulin preparation. For actors who are interested in being involved in musicals, there is a service called Glulisine that prepares them for the rigors and intricacies of musicals. Glulisine sounds like Glulisine, so this will be our symbol for Glulisine, another rapid-acting insulin preparation. Now we see a huge pop-up poster featuring a picture of Neil Patrick Harris. Neil is on campus today, and he will be putting on a clinic from 4 to 10 p.m. for intermediate actors only. Neil Patrick Harris's initials are NPH, and the fact that this clinic is for intermediate actors only should help you remember that NPH is an intermediate acting insulin preparation, and the fact that this only takes place from 4 to 10 p.m. should help you remember that NPH has a 4 to 10 hour peak. Toward the back of the scene, there's a plaque on the wall that says Long Acting Class. On one side of the plaque is a cutout of Heath Ledger's Joker, and on the other side is a cutout of Ben Stiller's Zoolander, with the famous blue steel expression. This class helps students prepare for the long-term commitments that some parts are going to require of them. Beneath the Joker cutout is a little sign that says detrimental character, which refers to the idea that to really become the Joker for this part, Heath Ledger ended up doing things that were very detrimental to his personal health. This portion of the class will help students prepare for those kinds of roles. And detrimental sounds like detrimer, which is one of these long-acting insulin preparations. Now beneath the Zoolander cutout, there's a sign that says glare and grin. This portion of the class will focus on the long-term training required to properly execute something as magnificent as blue steel. Well, glare and grin sounds like glargine. So when you think of this detrimental character Joker and this glare and grin Zoolander guy, just remember detrimer and glargine are long-acting insulin preparations. It takes a long time to get that good. So now that we've discussed the various categories of insulin preparations, let's now talk about the mechanism of insulin. A beautiful and very kind-looking actress can be seen taking a quick break on a tire swing before she heads to her next class. Tire swing sounds like tyrosine, and kind sounds like kinase. So this kind-looking actress relaxing on a tire swing should help you remember that insulin binds to a tyrosine kinase receptor. Now there's a bar toward the back of the scene with a uniquely shaped base that looks exactly like a liver. And a mom is standing next to the bar trying to take some glue away from her disturbingly mischievous-looking daughter, while the bartender slides a bottle of gin to her so that she can get her day drink on. The glue will be our symbol for glucose, and this gin gliding across the counter will be our symbol for glycogen. So all of this going on around the bar with the liver-shaped base should help you remember that insulin increases glucose stored as glycogen in the liver. So more glucose is stored as glycogen. A fitness actor holding a big bottle of whey protein is also standing near the bar, and the bartender is gliding him a bottle of gin as well. This ripped guy holding on to his protein and waiting for his gliding gin should help you remember that insulin causes increased glycogen and protein synthesis in the muscle. Now, there's a big fat guy eating some McDonald's that is standing next to the fitness actor. Greasy fatty foods like this represent triglycerides, and the fact that this fat guy is eating it should help you remember that insulin leads to increased triglyceride storage in fat. A stagehand can be seen entering through a back door with a cart full of bananas for the actors, so that they don't get cramps during long, strenuous acting sessions. Bananas are full of potassium, so all of these bananas entering the room should help you remember that insulin leads to increased potassium uptake in cells. Now, one of the theater techs accidentally left a pile of empty glue bottles on the floor after completing a project. Let's zoom in to see that better. Glue is our recurring symbol for glucose. So this pile of used empty glue bottles should help you remember that insulin can lead to hypoglycemia. Now, a bigwig from a production company is on site today scouting out the talent. This unfortunate looking guy has a buffalo hump, a very round face, and disturbingly thin arms and legs. This demonstrates lipodystrophy. So you gain fat in the core and you lose subcutaneous fat in the limbs. So you end up looking kind of like this guy. That's called lipodystrophy. So just remember that insulin can cause lipodystrophy. Now there's another producer sitting next to this guy, and he is so fat that he has to use 2 chairs when he sits down. This should help you remember that insulin can cause weight gain. Now another producer is looking up at the girl in the tire swing and crying hysterically because he is so smitten by her beauty. This hypersensitive and overreacting guy should help you remember that insulin preparations can rarely cause hypersensitivity reactions. And that should be all you need to know about insulin preparations.